Over the next half an hour, I'm just going to talk about AI and stroke imaging. Some of the materials and slides that I show you probably have seen before, especially in Dr. Tannenbaum's talk. These are my disclosures, not relevant to this talk. So we're going to talk about AI application in stroke, some of the current clinical applications and software platforms that are used in the field of stroke imaging. And then we will highlight some of the potential future research that can be done in this field. So you've seen this slide. There's basically a wide spectrum of what AI really can, how AI can affect our workflow, anywhere from, patients' medical record and scheduling, all the way to basically communicating the result to physicians and to patients. Where I'm going to focus really in this spectrum is, in terms of stroke and AI, would be in terms of image processing, perception, reasoning, and then we talk about some of these software platforms that they have option for reporting and communication. So when I think about AI and its potential role for image interpretation, I like to think about this pyramid. Basically, these are steps that AI can really help. At the very basic level, AI can provide automated detection of imaging features, something that may be difficult for us to detect, or sometimes impossible really for us. For example, radiomic features, it would be something that AI can clearly have an advantage of looking at and providing a summary for us. For example, quantitative imaging, as we discussed in previous talk a little bit. Segmentation, visualization, and quantification are some of the tasks that can be seamlessly be done with AI, at least potentially, and something that would be very labor intensive for us to do manually. So again, that's another potential step that AI can really help. And then decision support is really putting all of these together, summarizing the data, providing categorization, classification, and then at the very top of the pyramid, it would be to make actual diagnosis. And I think, again, as you go from the base to the top, the complexity of these tasks increase. And I think, where we are right now in terms of, at least for stroke imaging, most of these software platforms that I'm going to discuss, they're doing a very reasonable job for these three steps. So they can provide feature detection, segmentation, quantification, some degree of summarization and categorization. For example, this you probably have seen, some of you have seen these rapid maps, for example, of stroke patients. So they detect the feature, which is reduced diffusion. They segment and they provide volume, and then there's a report that would give you the result, and basically you can decide what to do with the patient. But to provide actual diagnosis, that's where I think still some work needs to be done. And the perfect example is that if you upload this patient with HSV encephalitis that has bilateral restricted diffusion to rapid software, you are probably going to get some volume segmentation that mimics the stroke. So I think that's where I think we are still behind and lagging, and there's some work to be done, and very exciting actually work to be done. But really, these three steps are